Fantastic. Okay, it looks like we've got everybody for the meantime. We're still climbing slowly, but in the interest of time, I will kick off. So good evening, everybody. Thank you very much for joining us tonight for this webinar. My name's Simon Wills. I'm the Events Executive at the MPA. I'm here tonight to support in the background. Just a few housekeeping things to say and how we're working tonight's webinar. We'll be using the Q&A function, so hopefully you're all familiar with that. You can find that at the bottom of your screen. Please do send us your questions throughout the presentations. We'll also have some time later on to actually answer some live as well, but please do send those questions in. We won't be using the raise hand function, so if we can encourage you to use that Q&A function instead. If you have any technical problems, can't see, can't hear, any problems, do send us a message to the chat. You should be able to communicate with us that way. Obviously, we're recording tonight's webinar for on demand, but obviously that will omit any of the questions that you send to us. But yeah, any problems, do send us a message. But hopefully you enjoyed tonight's event, and I will hand over to my colleague Jasmine.
Thank you, Simon. That's very helpful. And hi, good evening, everyone. And thank you for joining us for the NPA webinar on COVID-19 testing and UKAS registration. So I'll just kick off by saying hello to everyone and introducing my colleague Louise from the NPA and other guests from UKAS. So first of all, Louise Baglall is our Head of Learning and Development and doing a lot of work on COVID-19 testing. Both of us have been heavily involved in this for quite some time now, Louise, I would say, isn't that? And we are very pleased to be joined by Emily and John from UKAS, the UK Accreditation Service. Emily Ness is the Head of Sales on Training, Accreditation and Advisory at UKAS. And John Ringrow is the Senior Assessment Manager at UKAS. So hi, good evening, Emily and John, and welcome to our webinar. And thank you for joining us actually this evening.
Thank you for having us, Jasmine.
Excellent.
Very much. Thank you.
Thank you. So without further ado, I'm going to hand over now to John and Emily to proceed with the UCAS presentation. Over to you, John.
Okay, thanks very much, Jasmine. So good evening, everyone. As introduced, my name's John Ringrow, a Senior Assessment Manager with UKAS. I've been with UKAS for quite a few years now, been in accreditation both in UKAS and before that with Clinical Pathology Accreditation UK. I have a background in medical laboratory science as a microbiologist before I went into accreditation. So obviously, as you know, and as everyone knows now, the whole world has changed a little bit, and there have been a lot of applications going through for COVID-19 testing. So the purpose of this presentation is to just give you a bit of a background really on what we are doing from the UCAS side of things and how that dovetails into how the DHSC works with their operation and the sorts of things that private providers who are offering any form of COVID testing service need to consider. So can I have the next slide, please? So just a bit of background, first of all, on what UKAS is all about. We are the UK's national accrediting body. We were established quite a long time ago now, in 1995. And we operate under a memorandum of understanding with the Department for Business, Energy and Industrial Strategy. So really the whole ethos of accreditation is that it delivers confidence in products and services, and it gives any consumers, anyone, members of the public, organisations, a trust in products and services that are offered. Organisations are assessed by UKAS and they are accredited to an international standard. So that means that anyone who has been assessed against an ISO standard has been assessed in exactly the same way all over the world. So we operate with a set of standards ourselves, actually. So we are assessing in the same way that all other accrediting bodies across other countries within the rest of the world are operating. So anyone who's using a product or using a service can be confident that they have been assessed and accredited in exactly the same way. And that ensures consistency and it ensures conformity as well. One of the important definitions on the bottom of that slide is what accreditation is all about. So it's the recognition of competence of organisations to perform specific evaluation tasks such as calibration, inspection, testing and certification. And the key word in that really is the recognition of competence. We see the word competence cropping up all the way through when we're talking about accreditation and assessment. Next slide, please. So for you, how does the new regulation apply? Well, the health protection coronavirus testing requirements and standards of England regulations in 2020, they came into force for all COVID testing tests privately provided on the English market from the 1st of January 2021. So any providers for whom this applies who are not able to demonstrate compliance potentially could face legal action. An offence under this regulation is punishable on summary conviction by a fine. So if you are a provider that is providing the free tests locally commissioned on behalf of local councils or governments, even when offering the manpower at cost, this is not covered by particular legislation because the test is actually provided under the NHS Act, which is exempt in these regulations. So that's an important thing to understand. So to meet minimum standards, providers have to self-declare and they, where applicable, apply for UKAS accreditation. The testing lab has to be an applicant to UKAS or accredited to ISO IC 17025 or ISO 15189. Now we will mention these standards right throughout the presentation, but there are some other standards as well that is applicable to this. Samples must be taken by a provider or a subcontractor if relevant, and that applicant has to be working with ISO 15189 or 17025 as well. So if you are doing point of care testing though, you have to be an applicant to 15189 and 22870. 22870, as we'll mention towards the end of the presentation, is a standard that refers to point of care testing, and it's an adjunct to 15189. So if you are thinking of doing point of care testing, then the main standard, the key standard that you will be assessed to and you need to apply for is 15189, and then we tack 22870 onto that. Next slide, please. So if you are doing self-administered and home-based tests, things are slightly different. For home-based tests, where the samples are taken by individuals and then sent to a laboratory, the laboratory must be covered by UKAS accreditation. So the laboratories, they need to be either accredited to 15189 or 17025, depending on what they do. The laboratory will be responsible for ensuring that all of the instructions, the procedures are actually adequately detailed. Now, if it's a home-based testing situation where samples are taken by individuals, then they're sent to a point of care provider to analyse, the provider who is doing that test must be covered by UKAS accreditation to ISO 15189 and to 22870. For home-based tests that are sold by the provider, but the provider does not collect the sample or analyse the test, for instance, the new lateral flow technologies or some of those sorts of technologies, the provider that sells the test does not require UKAS accreditation. So there's a few things that we need to actually understand when we're working through the legislation, and certainly referring to the government website, the DHSC website, will actually help you to do that. Next slide, please. So if you are going through this process and you are going through the self-declaration process, there are various stages that we need to work through. So the first stage, stage one, is the DHSC self-declaration. It's required in order to offer sampling or testing for COVID-19. And part of that self-declaration requires that you apply for UKAS accreditation. So there is the government website will take you through that self-declaration. UKAS will review this and will communicate with DHSC. The next few slides will show the requirements for self-declaration, and there is documentation that is supplied with that to help you with all of that process. We then move on to stage two, which is the actual UKAS appraisal and assessment. Now, stage two is an appraisal of your preparedness for assessment, and requires completion of a form which UKAS have provided and is available on the UKAS website. And you submit that along with the evidence to demonstrate how you meet the stage 2 requirements. Now, when we compare stage 1 and stage 2, and we compare the DHSC self-declaration and stage 2, you will find that the stage 2 requirements are very, very similar to stage 1. And that's intentional, actually, to try and make the whole process a little bit simpler for you. And finally, we go to stage 3, which is the initial assessment. And then we move through the standard UKAS accreditation process in order to eventually get grant of accreditation to whichever standard that you've applied for. Next slide, please. So there are some various requirements for self-declaration as a private COVID testing provider. Now, I won't go into too much detail of this because most of it is available on the DHSC website, and there are various other links to other information. You will also find information and links on the UKAS website for this as well. So stage 1, requirement for a clinical or medical director and healthcare scientist. This has provided quite a bit of discussion as to what that role entails, and certainly where some of the providers have been struggling about this, they've been asking us lots of questions. So the provider, they must have a designated resource role that has oversight and approval of medical practices undertaken. Now, that person, they could have oversight of clinical practices. They may be a registered medical practitioner. They may be a healthcare scientist. They could be registered with the Health and Care Professions Council. So the same individual could have several different roles and several different hats on in that organisation, especially in a small organisation. Part 2 of that is the part 4 of the medical devices regulations have to be applied, have to be put into service, and you have to be following those things. That requirement is to ensure that the test product's got a CE marking, or once we know that the UK has left the European Union now, a UKCA marking. So I won't dwell into too much detail about exactly what the CE mark is or the UKCA mark is. There's a lot of information out there that will explain that. And part 3 there is alignment to DHSC MHRA target product profile scopes, including the validation data for the particular tests that you are actually applying for and you're actually conducting. So have a look on the website for the extra information to cover that. Can I have the next slide, please? So this continues on with the self-declaration requirements there. So we have to report results to PHE because they are collating all of the data from this, and that's important for their epidemiological studies and keeping track of progress of the pandemic, progress of the disease in various areas of the country. So it's important that there's a system in place for reporting positive, negative and inconclusive tests. Step 5, the relevant systems in place there to report adverse incidents and events. Now that has to be demonstrated that there is a system in place. It's important both for MRHA point of view, and it's also important for COVID-19. Now this, you may have systems in place already in your organisation, or you may need some help with setting this up. Certainly referring to the requirements of the ISO standard will help you with this and to guide you with what sort of documentation is required and what evidence is required. Part 6 is the sampling shall meet this or be working towards ISO 15189 or ISO 17085. So that is part of the UKAS registration and applying to UKAS for accreditation. You do require a clinical governance framework. So in any organisation, there will be some kind of organisational framework, organisational structure, charts, roles, responsibilities, and we're looking for the documentary evidence to actually demonstrate how that works. Point 8, if you are doing PCR testing, PCR lab-based testing, then as I've mentioned in the previous slides, that laboratory has to be accredited or going through, applying for accreditation for 15189 or ISO 17025. And again, for point of care testing, it's steering you towards 15189 and 22870, which is the point of care testing standard. Point 10 there, that there are legal and regulatory requirements for sample collection, processing and sharing of results, including the requirements for data protection legislation. So again, that is important. It's also tied in with the other legislation that you have to be compliant with there as well. And there's further information on GDPR, and the Information Commissioner's Office has also set up various frequently asked questions on data collection and data protection relating to COVID-19. So having a look on that information, the ICO website will help you for that as well. Next slide, please. So this is information taken from the DHSC website on showing you where the declaration as a provider is, and this shows you that you could start the link there. If you click on the link, it will take you through the various stages to help you start that, and it's a series of questions that you answer, and the facility to actually embed or upload information, evidence to prove that you are actually meeting those requirements. So that is the place on the website there for doing that. There's also other information on there on self-declaration if you are doing TTR, on any reference number requirements, subcontractors considerations as well, which we will talk about a little bit later, and I think Emily will update you afterwards a little bit on that, because it's important. It's an important topic that's come up before in questions. Also the notifications and results as well, and the channels of that, and also if you're involved in any police corroborations with the data, with what to do with your information. So that's it. That's important. Next slide, please. So as part of your self-declaration, applying for UKAS for accreditation is to one of the standards is a necessity for this. If you don't self-declare, and as part of this, apply for UKAS for accreditation, you will not appear on the DHSC published list of approved private providers, and you therefore cannot offer COVID tests as a private provider. As I've said, the legislation came into force at the beginning of this year, and making that declaration is a mandatory requirement for providers with the effect from the 1st of January 2021. So a private provider in this definition then is a non-NHS provider who may be able to provide COVID testing services. So that may be some of the people listening in today to this presentation. Next slide, please. So this details the application documentation that takes you through for the UKAS processes. So there are some documents that you are required to send to us, which will be a UKAS agreement. That's quite an important thing, because you're actually signing up to our terms and conditions as we operate as an accrediting body, as a business ourselves. We are still a business like many of you who are listening. There are application forms which come into two parts. The first part is the opportunity for you to tell us all about yourself and how you work as an organisation, the key people, what you do, the locations that you operate from. And the second part of that form is, again, quite an important part, because it details the actual tests or the actual processes that you're doing, whether you're a sampler, whether you're actually a tester, whether you're doing point of care. There's the application fee, obviously. There's the terms of business, and that is an important document. It's available on the UKAS website. There's a UKAS privacy policy, which we would get you to read, and some confidentiality waivers. Now that's important in terms of information flows and whether or not there are permissions involved in us being able to transfer information or pass information to the DHSC. So those are certain confidentiality waivers that have to be in place. So there's any other supporting documentation that's indicated in the application form that you send to us. Those are the addresses to send to, and if there's any help that you need with that, then there's an email address to contact sales for assistance. So there are various forms that you would need to fill out. If we go to the next slide, please. This slide shows an example of one of those parts of the forms, and it's called it's one of our standard application forms. It's called an AC6, and it shows the scope of the application. So the example here there is that this organisation, they will probably tick a couple of those boxes for 15189 or 22870, depending on which they apply for. And the next boxes in the bottom left of the screen will show there where you actually record exactly what you do in terms of the particular testing that you do. So AC6 it's labelled actually on our website as an F560, and it's subtly different from our standard AC6 form. We've had to take this and adapt it to suit the COVID application process, but it's part of the same process, if you like. So the application form, it outlines the activities that need to be accredited, and it ensures that we can understand the specific methods, the sample types that you're using, because that's important later on in the process when we come through to the assessment and then working out your schedules of accreditation afterwards. Next slide, please. So this is at the bottom of this application form. These are any supplementary questions that may be required. Some of these may not necessarily apply to you, but they may do in some situations. So having a look at the content of those, it just depends on what type of organisation you're operating in as to whether you say yes or no to those. If you do say yes, then there's detail to actually provide us a little bit of further information. For instance, one of the common things that sometimes organisations will be telling us about is that they offer some kind of phlebotomy service as well, if they are maybe taking blood samples, perhaps for COVID antibody testing or for point of care testing. And those are things that are accreditable, but we would need to have some discussions with you about how we would proceed with that. Next slide, please. So what happens next? So you've sent the application form in. We will acknowledge that, and then some financial checks are carried out, and that's to enable us to be confident in yourselves as an organisation. And eventually, the application will be assigned to an assessment manager, not an assessment manager, to take you through your accreditation journey. The assessment manager will then contact you to discuss the application and look at the various options to proceed. So that will be through stage 2, which will be the review, and then stage 3, which will be the initial assessment process itself. Next slide, please. So this is taking you through those steps again. So the next step is stage 2. Section head reviews the application, and the assessment manager reviews the application as well. So the section head, the way that we work within UKAS is that we have various different sections within the organisation, and they deal with different aspects of accreditation and different industries, different organisations. So myself, I work in the healthcare section. So our healthcare section head is Ben Courtney, and he's been doing a lot of work both before the law, before the whole thing became law. He was working very closely with the DHSC in setting all of these processes up. So he is responsible for looking at a lot of the stage 1 things. We have had a team of some of my colleagues actually working between Christmas and New Year, reviewing a lot of stage 1 things that were coming in quite quickly. And then we pass on to stage 2, and we've then got another team of assessment managers who are reviewing the stage 2 application process. So that's the different form that comes in with the extra evidence, and they're reviewing those things. Next slide, please. So what can you do in this? The main thing is communication is the key. It's engaging a two-way communication between ourselves and yourselves. We understand that this is very new. It's certainly very new for all of these organisations who've been doing this. It's a very, very short timescales that we're operating in. And it's fair to say it's quite new for UKAS as well. And we are getting used to things as well. And we are getting used to dealing with a lot of things, making decisions very, very quickly throughout this as the process develops. So it's a two-way, bi-directional, UKAS to yourselves, to UKAS. The interface, the main interface is the assessment manager, and internal communications is essential for any change because it's then openness, it's transparency, it's engagement, it's ownership. You're taking ownership of the project, of what you do, and it's involving yourselves, it's involving ourselves to help you eventually get to gain accreditation. Next slide, please. So if we look at stage 2, there are 13 key requirements that are appraised by UKAS in stage 2. The first one, it may seem a little bit of a crass statement, but we do see a lot of organisations who have not got a copy of the ISO standard. So it's that making sure that you have a relevant copy of the ISO standard and that you've conducted a gap analysis. Now we have a gap analysis form, and UKAS have done a number of webinars to help people to understand this so far, and I think we will be doing some more webinars to help people who are maybe later applicants in this process and are still wanting to find out some more information about it. But the gap analysis will identify your gaps and where your differences are between what your processes are now and how you need to fill those gaps in order to fulfill and meet the requirements of the ISO standard. So please, please, please buy a relevant copy of the ISO standard and actually read it. Part 2 then is defining the structure with the reporting lines, responsibilities. As I've mentioned before in a previous slide, most organisations will have organisation charts, they will have job descriptions, they'll have reporting lines, people will have various duties, tasks that they need to do. So we're looking for evidence to actually meet those requirements there. The third one is the adequate liability insurance, and that is making sure that you are covered for the relevant work that you do, and that includes the COVID work that you do as well. You also need to have the access to the relevant clinical expertise. Now, the expectations that vary between what standard you're doing. There is much more emphasis because 15189 is a medical laboratory standard. The emphasis there is a lot more on the clinical input, whereas for 17025 it's purely a testing laboratory requirement. So there's less clinical input, or there's very little at all. So if you are going for 15189, then you may well need to have some discussions about that clinical expertise or thinking about how you get, where you get that from. Next slide, please. So the gap analysis there, it's just, we thought it was useful just to explain why it's actually helpful. It's used to compare where you are now with your ISO standard requirements versus the actual what you've got in place. It identifies the gaps in your management system. Once you've completed that, you'll have a better resource, better idea of where you need to direct your resources to. You need to maybe plug any gaps in there. You may need to assign actions to people to do, set timescales for that. And it also helps you to monitor progress towards your eventual compliance. So we suggest that you carry out the gap analysis alongside writing your draft quality manual. So writing a quality manual, that also focuses you and it enables you to think about in a lot more depth how you meet requirements of the whichever standard that you're applying for. Next slide, please. So these ones don't require that much explanation, actually, that we've got sufficient trained and competent staff, and that we require to see records of training and competence assessment, and that includes training and competence assessment for the COVID work that's actually being done. So that's quite important. If you are being accredited for COVID work, then you need the appropriately trained and the appropriate competent staff in order to do that. Okay. So we would be asking for evidence of that. So samples of training records, completed training records, of course, and completed competence assessment. And also that all the way through this, you will see the mention of having documented procedures. So the requirements of ISO standards require that you do have things documented down as processes. Your processes are documented as SOPs, as procedures. One of the little adages that we have as assessment managers or as quality management assessors is saying that if something ain't written down, it hasn't been done, or you don't do it. So something has to be written down. So thinking about all of your procedures, all of your processes, and making sure that you have those recorded as documents. So we also expecting that you would have validation for the technical methods that you do, and demonstrate that those can actually achieve the stated performance characteristics. Now that is also very important because there are different validation requirements and different performance characteristics depending on whether you're doing general population testing or whether you're doing testing of a test to release. And those requirements are very, very specific, and you'll find that information on the DHSC website. And it's very, very explicit that those things have to be met. Part 7, documented procedures for certain aspects of your processes, which include your sample collection, your transport, if that's applicable, the storage and the analysis. Now, if you're doing sampling only, there may be very little requirements for those, but there still needs to be some kind of process in place and some kind of procedure in place, even though it's minimal. If you're doing any form of testing or you're doing point of care, then there will be further detail for storage, transport, and then stock control, those sorts of things. Part 8 is very important as well, and it's another area that we've had a lot of questions about in terms of what people do for our internal quality control and also for external quality assurance mechanisms or other inter-laboratory comparison schemes. So if you are doing testing, it's very important that you challenge what you do and you make sure that the tests that you do are actually working appropriately. And that's where IQC and EQA comes into being. Now we have extra information, and we'll be able to point you in the right direction for various websites in order to help you if you are looking for IQC, if you're looking for EQA schemes. Again, for COVID, it's quite new. There are companies and there are proficiency testing providers that are setting up pilot schemes now for doing this. So it's new, but it is in place. Next slide, please. So number 9 is that facilities meet relevant containment level requirements. Now there are some containment level requirements for COVID. Obviously, COVID is quite a nasty virus to be playing with, and as with any laboratory situation, you would expect to find, say in an NHS laboratory, there are various containment levels depending on the type of pathogen that you're working with. And similarly, that we need to have some kind of containment in order to for general health and safety, and for the protection of both individuals coming into your premises, for your staff, etc. So you need to have facilities, and thinking about that, and thinking about your risk assessment, thinking about your health and safety, your environmental management, to prevent cross-contamination. That you also need to have appropriate interpretation criteria. Now that might be in the validation of software if you are doing validation. It may be in reports released by your organisation and released to an individual or released to PHE. If there's any calculations that need to be done, that we would be assessing some of those things. Part 11 are on the appropriate procedures in place to ensure that testing is performed 5 days post self-isolation. There are other agreed turnarounds and for reporting in accordance with statutory regulations. And that's quite important in terms of TTR as well, that we need to meet those regulations for reporting SARS-CoV-2 testing results. Next slide, please. So the final two steps there that we need to be assured that you are working towards and you have things in place for is reporting, procedures in place to report, resolve and report adverse incidents, including clinical incidents. Now that is a little bit more far-reaching. You might think, well, some organisations do have things like this, and sometimes, especially in organisations that are managed by larger groups, for instance, in pharmacies, there may be standard documentation that can be used. But what we are quite interested in is to make sure that it's been applied to your own situations, it's maybe been adapted to your own situations, and it's actually relevant to what you do. And that statement is quite important when we're looking, when we're talking about any ISO accreditation and any ISO standard, that we are looking for conformity, we're looking for consistency, we're also looking for compliance with the standard, but we're also looking, we're also in a way assessing in a holistic way. So the various organisations have different ways of doing things. What we have to be assured is that what you have got in place actually works for you, but it still meets the requirements of the standard. So there are various different ways. A different organisation may do things in a slightly different way, but however it does it, it still meets the requirements of the standard. And the final part of that is procedures to safely dispose of clinical waste. And again, you may have generic procedures in place for that, but it has to be relevant to what you do. So looking at what you do, taking that documentation, that generic documentation, and applying it and making sure that it also meets requirements of the relevant standard. Next, please. Next slide, please. So we have various expectations for the evidence submission. Please use the form on the website that clearly specifies the documentation required. That's important. And another thing point that I think is useful to mention from my own experiences of reviewing quite a lot of these stage 2 things now, it's important to actually send us the form back in a Word format rather than PDF, because we are going to be providing you with some feedback. And if you send it back as a PDF, it becomes difficult for us. We have to then convert it to a Word form to send back to you. And we've had a few instances with a few organisations where we've been playing a game of ping pong. With we send it back as a Word, they convert it to PDF, send it back to us, and so it goes on. So making sure that you keep it as a Word document. You can embed the documentation within the form. That's the easiest way of doing things, because it means then that everything is all in one place, and it makes it easier for the reviewer to just open the relevant documents because they're all embedded in that form. If you do send separate documentation in, though, make sure that you label which part of the requirement that documentation is relevant to. For instance, if you're sending in an organisation chart, make sure that you label it, if it's separate, that it is relevant to part 2 of the stage 2, so that we can see clearly. But the easiest way is to just embed within that form. Submit the evidence to the address specified by the deadline specified. That's important as well, because we have deadlines all the way through this process. If no evidence is deemed applicable, then explain why. Even if your role is only part of the process, there should be an understanding of the rest of the process. For instance, which organisation do you work with? What do they do? How do they meet requirements? So explaining that to us within the form is very, very useful, and it gets us to understand how you operate. Next slide, please. So on the stage 2 outcomes, then we will provide you evidence submission back from ourselves with a report on whether that evidence does or does not meet the key 13 key requirements. And we will give you some indication on where that evidence is lacking. For instance, if there's a document missing or something else needs further explanation or clarifying, then we'll indicate that to you. And we developed a system of if something is not quite right, we'll type it in red. If it's approved for stage 2, then we'll type it in green and state that it's approved So that makes things easy for you. So if you focus on the red bits, then it means you've got to do something else. Where the evidence is insufficient, we'll request further evidence, and that has to be submitted within 7 days. Any gaps feed into the gap analysis. So if there are gaps we've identified, then make sure you update your gap analysis form as well, because we'll go back to that first question and we'll have a look at your gap analysis. If you are accepted for stage 2, and if that's granted, the information is then passed back to the DHSC, and you as a provider will be maintained on the government website. As I said right at the beginning, you've applied through the self-declaration process for stage 1. Once you've got through stage 1, you will be put onto the DHSC website. So at stage 2 then, if you've met the requirements of stage 2, you will stay on that website. If for any time you fall through the gaps or you've exceeded timescales and things, then you will be taken off the DHSC, and there will be then a process afterwards where in order to get back on again, then there will be a further length of time for you actually to submit the documentation, because you have to get through stage 2 again. After you've got through stage 2, we will propose the next steps after stage 2, and that includes when the initial assessment can actually proceed and take place. Next slide, please. So we've got some timescales there. So we've got deadlines for the submission of evidence. They are written into legislation. So that's 28 days from the date of the application or self-declaration. You as a provider have that deadline to submit the stage 2 evidence, and that must be done, or there's a risk then to remove it from the published list of providers. So we have some timescales that we have to meet as well throughout this. We review the documentation within 7 days. We confirm to the provider and DHSC if that's successful. If there's further evidence required, you as a provider have a further 7 days to submit that. We will make the DHSC aware of that. On the submission of the second round, the UKAS has a further 7 days. So we've got the theme going through there of 777, thinking about that. And eventually the successful outcome will lead to maintenance on the DHSC published list. If you're unsuccessful, the providers will be removed at this stage, and then we can take things a bit further. If you're wanting to actually get back on again, or you need to review things, within your own organisation. That's up to you. Next slide, please. So prior to the assessment, this is an indication then of what the flow chart will be, or the flow process will be, prior to actually the initial assessment. We are working through, and this is initially for sampling providers, certainly, planning to take place during mid-March through to the end of June. So we have some processes in place that we're working through now at the moment. And I believe we've even got, I think 1 or 2 of the first sampling providers are actually going to be having their assessment from next week onwards. So that the process is actually starting in earnest now. So the UKAS head office will contact you to discuss a suitable date for your remote assessment. And I mentioned that it's going to be a remote assessment, that we won't be actually coming on site. It's difficult at the moment anyway, because UKAS are still doing all of their assessing remotely. Eventually, as we move through the year and as lockdown becomes released and people start to get back to some more normality, then the UKAS assessment process will return to more normality. So UKAS head office will confirm the assessment dates and the teams with you, and issue you with a confirmation. So that then you will know when your assessment is going to take place. You'll be provided with a provider assessment tool to review and populate in preparation for the assessment. And the assessment manager then, or the lead assessor, will contact you to discuss the assessment and how they're going to deal with that. So there will be an initial sort of pre-assessment review of the information provided in that assessment tool, and noting any of the items to follow up. And that is actually quite a useful part of the process. There is a very large cohort of providers in the sample testing group, but we are actually doing assessments for testing laboratories in this process as well. So in between all of this, we've also got laboratories who provide the testing for COVID, and we're actually working through those at the same time. Next slide, please. So the assessment itself, generally, as we are conducting this by remote assessment, there'll usually be Teams or Zoom links created and included in the PAT for you, ready for the assessment. So please check that those things actually work prior to the assessment day, because that's we need to make sure that the IT does work, because there'll be a lot of dialogue between ourselves and yourselves. The assessment, as any assessments do for UKAS, commence with an introductory meeting. We will then conduct your document assessment and work through the patch sheets and the information that you've provided for us. If required, and if there's any improvement actions that are noted, we will confirm those with any authorised individuals and work out an improvement action as necessary and record those. We'll provide feedback at the end of the assessment and make a recommendation on the accreditation. Following the assessment, you will need to complete any improvement actions and submit that evidence to UKAS for review, and there will be a time limit that you will need to do that. Finally, when accepted and the assessment's been independently reviewed and approved by an independent decision maker, accreditation will be finally granted at the end of that process. Next slide, please. So in any initial assessment process, there's always an element of planning, there's an element of approach. An assessment plan, in this instance, especially if you are a testing laboratory or you're a testing organisation, then there will be a plan which identifies which activities we're going to actually be looking at. It provides a timetable. It's also based on the scope of your application and how complicated your setup is. I will also mention that there's a draft schedule of accreditation that we will prepare, and that's based upon that AC6 form that we saw right at the beginning of the presentation, and that details exactly what you do and identifies on your schedule what you're going to be accredited for at the end. Assessments are also done by risk, especially if it's a large organisation, because we may not be able to sample everything that you do in every location. So we were looking for high risk activities or high risk areas within your organisation that may overall affect the accreditation process. So those are the areas that we would focus on. Next slide, please. So we've got at the assessment, we've got a lead assessor or an assessment manager. We've got technical assessors. They may be as many as are actually needed or required for this, and we have technical experts as required. So they will be engaged in reviewing the documentation. They will be interviewing various staff and, if necessary, witnessing activities that are taking place. And that can be done by Zoom or it can be done by Teams meetings. And also they will be looking at reporting processes as well. Also, we will be reporting, so we will be issuing improvement actions if we feel they are necessary to do that, and we'll issue you with a report at the end of this. Next slide, please. So we've mentioned risk before. It's all about management of risk. Quality management systems, if you have a quality management system, that is detailing how you cope with and how you manage risk within your organisation. And it will include, your quality management system will include policies, procedures, instructions. Your organisation will have an approach to risk. So we would need to look at that and how you manage that as part of your overall processes and procedures, and how you actually go towards minimising that, controlling it, and dealing with any mitigations of any risk as it operates in the organisation. Because what it's all about eventually is providing a safe organisation, safe services to your patients, to your users, the end users of your service. Next slide, please. Assessment outcomes, we would have a closing meeting where we summarise things. We would issue you with these action reports, which will detail any findings. The assessment report will detail a summary, a recommendation, the level of conformity, and where we feel you are at within the process and any actions that you would need to require in order to fulfill or be able to meet the requirements. And it will comprise both technical and clinical content if appropriate. Eventually, after review by an independent decision maker, we will grant this once all of the findings are cleared. So then you will be issued with your certificate of accreditation, and the schedule of accreditation is published. Next slide, please. So last few slides just focus a little bit on expectations of assessments. So laboratories, point of care providers, they have evaluated methods. So that's one of the things that we are focusing on, or as an organization, not necessarily a laboratory, will have evaluated methods. Are they fit for their intended use? So that's one of the questions that we have, and your assessment report will comment on those aspects of that. So first of all, that you're using properly evaluated methods and that they're fit for purpose, and that they comply with the relevant standard. And those are the themes that we take through assessment itself. Next slide, please. So just a quick definition of what point of care is all about. A couple of definitions there. So from the standard itself, 22870, point of care testing, or near patient testing as it's sometimes referred to, is testing that is performed near or at the site of the patient with a result leading to possible change in the care of the patient. So that is quite important, and it's an important difference from a laboratory-based test. So if you are offering point of care, then you need to go down the 15189 route, because 22870 is an add-on standard to 15189. Next slide, please. Just a quick mention of decision making. We've talked about decision making before, and we have this within UKAS itself. And it's important to introduce an extra level of scrutiny over all of the documentation, over the accreditation, the assessment process itself, to make sure that UKAS processes are followed, that we've followed due process, we're meeting requirements ourselves for an ISO standard, and that's the one that's relevant to accrediting bodies. So we have a provisional decision stage where it's viewed by a decision maker. We may offer accreditation based on that. We may ask for some more information or ask for more questions, and we would also provide you with an estimate of effort for a 4-year cycle. Accreditation cycles last for 4 years, so you'll have an initial assessment, and then you will be assessed every year. Usually after accreditation, it's assessed. I've just gone to speak of you over the top of things here.
Apologies, that's my internet connection.
Okay.
I do apologise.
Okay.
Give me 1 second. Hopefully you should see that again.
Yeah, we're back to that. Okay. So we've got in this decision-making process, we were talking about the 4-year cycle. 6 months after the initial grant, you will have a first surveillance. Then on a yearly basis after that, you will have another surveillance visit up to the year 4, where you will have a reassessment, where we will look in much more detail at things again. So every accrediting body has a what they talk about as an assessment cycle. So in UKAS, this is a 4-year cycle. If you accept the offer of the accreditation, then you would return a piece of paperwork signed that you've accepted the offer and the estimate of effort, and then a final decision is made. We check that you've made sure that you've cleared all the improvement actions before we then grant accreditation and issue you your appropriate certificates. Next slide, please. So this is just an awareness slide that there are of the key importance standards that are around. First of all is 15189, which is the medical laboratories one, and that is the one that you need to work in conjunction with 22870. If you are not a medical or a clinically led service, then you might, or perhaps if you were a sampling organisation only, you may apply for 17025. So that's general requirements for testing and calibration laboratories. And finally, that last standard there, 17043, is the standard that all of the proficiency testing bodies, so where you are applying for a an EQA provider, they will be accredited to 17043. So when you are selecting EQA, then it's important to make sure that those people are relevantly accredited to 17043. Next slide, please. So this one, just a few very quick points just on preparation for assessment. First of all, read and interpret the relevant standards. We very frequently go to organisations where they still haven't got any idea about the standard and they haven't looked at it yet. It's a very good idea to prepare for an assessment by reading the standard. Do your gap analysis, because that's going to be a working document for you to help you through the process, making sure that you have the appropriate quality management system documentation in place, ensuring that all of your staff in your organisation are familiar with that and that they're familiar with the whole concept of accreditation and assessment and what's going to go on. And also in defining your roles and responsibilities for your scope of accreditation. So that's also important as well, to make sure that we've got the appropriate training, the appropriate competency in place. Next slide, please. What are we looking for? We're looking for conformance with the relevant standard. We're looking to make sure that you have competent staff in your organisation and that they are competent in the tasks that they perform that's relevant to the COVID testing. And we also make sure that you have sufficient control and assurance processes to actually manage your risk and to make sure that the end product, the result that you're issuing perhaps to your end user, a patient, a person, a member of the public, is appropriately controlled, it's appropriately managed, and it's the right result to the right person at the right time. I'm sure you're familiar with that concept. Next slide, please. So we have previous activity to ensure the assessment consistency. So providing assessment plans, timetables, making sure that you understand when we come into you that we know exactly what's going to go on. We have the assessment activity itself, which then goes through your processes, your procedures, enables us to understand and enables you to demonstrate that you are complying with the requirements of the relevant standard. And we have the post-assessment activity, which is then making sure that there's the appropriate reporting, that you understand things, that you are able to clear any non-conformances, any improvement actions that are raised at the time of the assessment. Okay, the final slide, I think, is the close. So thank you very much, everyone, for listening. I hope you found that useful. I've been keeping a quick eye on some of the questions that are popping up as well. So I think some of them are being answered or have been answered in real time. But now I think it's back to our hosts to manage any questions.
Unless
Right, so hi, thank you, John, very much. That was really informative, and I hope everyone has found that accordingly. I'd like to bring in Emily now to address a couple of additional questions, and a question in particular regarding group providers of COVID testing and how UKAS registration works for group providers. Actually, Emily, that'd be really helpful to know if you could cover that, please.
Yes, of course. So group providers has come up quite a lot over the last couple of weeks. And what we mean by group providers is any organisation who is performing the majority of the testing service, providing you with some kind of membership or online booking system, and you are then taking the samples on their behalf, and they are informing you that you are covered under their central accreditation with UKAS. It is possible that that is the case, but as the provider, I think we want to make it very clear that it is your obligation to ensure that you are conforming with the new regulation. So as a legal entity, you want to make sure that that legal responsibility doesn't sit with yourselves. So sometimes in those group provider scenarios, it's absolutely critical that you confirm with your group provider that number one, they are progressing through the UKAS 3-stage process. So they may be on the approved government list, but they need to still complete stage 2 perhaps. So it's quite important that you have those discussions with your provider to check that they are that they've maybe completed stage 2 or they're moving through stage 2. And we will be sending some text to Jasmine and to Louise, who can circulate these perhaps in the FAQs on what kind of conversations you should have with your provider to ensure you're covered under their framework, their accreditation. The other thing to note is that if you are to be covered under the accreditation of a group provider, they need to be taking legal responsibility for the activities that are being undertaken in your pharmacy. So contracts need to be in place and they need to be watertight, and that central provider also needs to ensure that the standards are being complied with at the point of sample collection and within the pharmacy, which is a huge amount for the central providers to take on. Some of them are doing that, some of them are working on it, some of them are communicating various things with all of their community pharmacies that they're working with. But it's best to communicate with them and just explain to them that you understand that they need to take legal responsibility for the sampling activities and for any point of care testing activities happening at your site, and ask them how they intend to cover this if you don't feel comfortable that that has been covered by your contract or your agreement. So we'll follow up with that text to you later, Louise and Jasmine, so that you can provide it to everyone on the call. But I hope that clarifies a little the situation on group pharmacies as it stands at the moment. Group providers, sorry, as it stands.
Brilliant. No, Emily, thank you very much, because as you quite rightly said, we've had a number of questions regarding that. In terms of if pharmacies are partnering perhaps or working with group providers, and especially if they're a separate legal entity from the group provider, then how the UKAS registration works. So I think that's clarified a little bit. And if I may summarize, the two key things: any pharmacy considering entering into any arrangement with a group provider needs to ask whether the group provider has successfully completed or is in the process of completing stage 2 of the UKAS appraisal process, and also understand how the group provider is taking legal responsibility for the sampling activities and point of care testing, and how they're intending to cover this, so that the pharmacy can be considered as being working under the group provider's registration effectively, and to ensure that all the contracts are in place. So there's a lot of work to be done on that front before the pharmacy should proceed with providing any testing under a group provider.
Exactly that, yes. And until they can be sure, or you can be sure that you are complying with the new regulation, be very careful in this current market with what services you're providing.
Absolutely. No, thanks, Emily. That's helpful. And what we'll do is, following this webinar, it is our intention to communicate some additional information to our members next week, following on from this, and to also provide some information on the group providers registration. So we'll wait to receive some text from you, and also re-highlight this webinar again to those members who haven't been able to join us tonight, so we can reissue that information. So thank you very much for that. John, was there anything you wanted to add to this bit on group providers before we proceed to the Q&As?
No, I think that was very succinct and very well summarised by Emily there. And I know we've had lots of questions ourselves in UKAS about this as well. So I think it's worthwhile having some clarity, and certainly for your organisation members who've come in tonight, and also if you're releasing this information elsewhere, hopefully that will get the message through.
Absolutely, and thank you, because I think we've had conversations, of course, with Emily in a lot of detail actually prior to this webinar, and I think the one thing we've all realized is just how complex this whole area is effectively. So I think tonight I'm hoping it's brought some clarity. And Louise, did you have any thing to bring in at this point on group providers or anything?
No, not necessarily on group providers, but I suppose there was a question in the chat that I haven't answered about do MedicSpot cover all the aspects necessary for providing PCR tests? And the answer is yes, but MedicSpots, we're providing PCR tests, not antigen tests, and it is an OTC transaction. So it does require Department of Health and Social Care self-declaration, but that isn't UKAS accreditation. So I just wanted to make that a little bit clear. So they do have to go through the DHSE to actually self-declare.
Thanks, Libby. So I think that falls into what John was covering quite early on in the slides, your slides, John, you know, where the supply of the test kit does not involve any sampling activity or analysis of the results or giving out, and is purely a supply function only. I think that's what it covers under, if I'm understanding that correctly. Would that be right, John?
Yeah, that's correct. Yes.
So effectively, it's a supply of a test where the patient who purchases it self-administers it.
Yeah, and the self-administered test, and whatever that happens. If you're thinking about it as the end-to-end, the whole end-to-end process, it's that whole end-to-end process is the bit that is the accreditable bit. Whereas if you have, we're looking for an unbroken chain there as well. So if you're issuing a test kit to somebody to take it home, and nobody's actually supervising that, or that no one's given any instructions on how to take that and manage that, then it's an unbroken chain, and that can't be accredited. So.
Right.
So in the case for MedicSpot, they are UKAS accredited, and they're providing the transactional OTC element to the pharmacy, for the pharmacy to provide the OTC sale, but they will provide the end-to-end service with all the customer support and all the logistics, providing results. So obviously, as when you were going through all the different documentation, it is definitely an end-to-end service whereby it meets the criteria.
Yep. So apologies, I've just shared my screen quickly because I was going to come on to this in a couple of slides, and I'll come back to it in a minute on MedicSpot again. Shall we cover up some Q&As, because we've had actually a very quite a healthy number of questions being asked by our participants tonight, which is always good. It also suggests that I think everyone's had a huge amount of interest in this, I would say. So Emily has kindly been answering some of these questions in the Q&A function here while John's been speaking with us. But if I may pick up a couple of them, is that okay to proceed, panelists?
Yeah, that's
fine. Thank
you.
So I think one of the questions that has come in about 2 or 3 different formats, but I think we can ask once, is can pharmacists perform the role of a medical director or the healthcare HCPC role as required as part of the registration process?
Right. Now, if you look at the requirements of 15189 under the laboratory director bit, there are various things that can either be taken on as a role of the medical director, if you like, or the laboratory director, as it's called in that standard, or they can be delegated duties or roles. And it's also you just need to think about what form that clinical input is going to take, why it's required in your organisation, and what sort of advice is given. If the advice is particularly relevant to COVID, then your organisation may need to perhaps look elsewhere, or they may need to engage the services, maybe one of the local GPs who may be working with your pharmacy or providing services to your pharmacy. So that medical or that clinical input could come from there. So it's also thinking a little bit out of the box as to where this is going to come from. And as long as it's clear, it's written down, and that there are roles and responsibilities recorded, documented, and everyone understands this, and it's clear and not sort of organizational charts where that flow comes from, then there is a little bit of scope for the interpretation of that.
No, so that's helpful. And because also this will be part of the UCAS registration process, then if there's any sort of things that you need to ask the pharmacy to explain further or anything, then presumably this can be resolved as part of the ongoing communication through the registration process.
Yeah, and
accreditation process.
through stage 2.
Yeah.
So if we need any further clarification of this, then
Yeah.
we can ask that through the stage 2.
Okay, no, thank you, John. That's helpful. And so I think one of the questions that has come through the chat, and again, John and Emily, you should be able to hopefully shed some light on this, is does the UCAS accreditation process apply to any other testing, either with group providers or independently, where people are conducting things like phlebotomy, for example, for immunity or finger prick testing or allergy profiling? So things which may not necessarily be COVID related.
Yes, we have or we are able to list activities such as phlebotomy on a schedule of accreditation, and it's not classed as because phlebotomy is actually not a test itself. It's a support activity.
Yeah.
So it will be listed in a slightly different way on a schedule of accreditation. And in some laboratories, say in NHS laboratories that we accredit, we would have phlebotomy as a support occupation or a support process against that laboratory. So if you were taking blood samples or you were taking finger pricks and you had somebody trained in phlebotomy to do that, and you wanted that activity accredited, then engage in that discussion with us.
Okay.
But for things like the finger prick testing, for allergy profiling, those sorts of things as well, we have a statement in UCAS that anything that can be accredited is. So we work with you to work with you to try and accredit things, but have that discussion with us depending on what you want to do. I'm thinking about that finger prick testing for allergy profiling. That may be something that we could do in the future, but for the time being, for the purposes of this webinar, perhaps focusing on COVID.
No, absolutely right. But I thought it was an interesting question, actually.
Yeah.
So,
yeah.
Absolutely. And just to clarify, in terms, because our membership is spread out across all 4 UK countries.
Yes.
And just to clarify for our listeners today, that this the requirement for this registration accreditation at the moment under the health protection regulations and coronavirus testing is applicable in England only at this point.
Yes. Yeah.
Is there anything which might be coming down the line for the devolved nations, perhaps, that you're aware of potentially?
I am not aware of that at the moment. I don't know whether Emily is, or whether we need to take that further to anyone else in UCAS if they've heard any other information.
So not to my knowledge either. I think the Welsh Government were working on a similar scheme, but I haven't had any updates on that in quite a long time. One thing to note is it's not just for English providers, but English providers operating in the English market as well. So we have had some instances where the DHSE have confirmed that if the provider is based over the Welsh border, but comes into England to deliver any testing activities or sample any individuals, that is then under the English.
Right. Okay.
regulation.
So that's a useful distinction to know, actually. So thank you for that. There's a question about the ISO standards that John has referred to in the presentation, the 15189, and I honestly cannot remember the other number, but the 2 main standards. Sorry, and how pharmacies can become more familiar with the requirements in those standards, perhaps.
Yeah, we as a UCAS as an organisation, unfortunately, we cannot issue you with a standard. You have to buy the standard yourself.
Right.
And the UK distributor of ISO standards is actually BSI.
Right.
So if you go onto the BSI website, you'll be able to purchase a copy. You can either purchase a hard copy of that, or you can purchase a downloadable copy of it. And for personal preference, I think it would be easier to actually do a downloadable copy. for yourselves
Right.
rather than a hard copy. But it's a copyrighted document as well,
Yes.
and that's
Yeah.
why we can't issue it.
And just to clarify for our members, BSI is the British Standards Institute. So just noted also that the ISO 15189 is dated from 2012 and is currently under review. And you may or may not know this, but I'm just wondering if it's likely to have significant changes when it's updated and issued fairly shortly. I'm looking at things perhaps.
COVID, as it has impacted all of our lives in various ways, it's impacted upon the review of standards across the world. And as you appreciate, it's an ISO standard, it's a worldwide standard. The review of the standard takes place worldwide and has the input from accrediting bodies all over the world. And that has been delayed. So Ben Courtney, who's our section head, he is representing UKAS on the review group for 15189, and it is there have been various revision editions of this thing released for discussion now, so it's still at those discussion phases. We are anticipating, I think it will probably be towards later into next year when the final edition will be released. In terms of the changes that will be taking place, ISO 15189 is probably unique amongst ISO standards in its format. And one of the main parts of the revision will be to make to bring it more in line with, say, the other standards, say, for instance, 17025. So the format will be along the lines of 17025. One of the other changes that will impact is that they will be annexing 22870 as part of 15189 at the end, and that kind of makes things a little bit easier for point of care providers as well. So if you're looking at things, the order will change slightly. So the management bits will be at the end of the standard. The technical bits will be first, and point of care will be dealt with in a slightly different way. It will be integrated in some way.
No, that's fine. So when we send the information out to members next week, we will link in the BSI information on what the contents of all these standards are and where they can be obtained from, essentially. So also just to clarify this question, that the whole requirement for UKAS accreditation and the health protection regulations which underpin this requirement, they are not applicable to antibody testing.
Not at the moment, no. No.
So this is only applicable to testing to see if somebody actually has the virus at the time of testing, so when the sample is taken, which is effectively antigen, as people recognize it. Effectively, right. And also, just to make sure that I've understood it correctly, if a pharmacy is involved in collecting samples from the patient in any shape or form, whether that sample is then analyzed by the pharmacy itself through a lateral flow device or is sent off to a laboratory as part of PCR testing, if sample collection is taking place at the pharmacy and is conducted by a member of the pharmacy team, so that it's not a self-administered sample by the patient, but the pharmacy team is involved in taking that sample from the patient. I'm just making sure it's completely clear to everybody what type of sample collection it is. Then number one, the DH self-declaration should be done by that pharmacy. And also the UKAS registration is required for sample collection as well. Have I understood that correctly?
So you will become accredited then for sample collection. And and if you actually participate in the actual sample collection itself, then you would do the self-declaration, apply for UCAS accreditation. And if you are then sending it as part of that process, as part of the sampling process, we're still interested in where you send the sample to, because that's an important part of the end-to-end, and where the resulting is coming from, whether they send the results back to you, you issue the results. But you're correct. If you are actually doing the sampling yourself, then you'd apply as a sample.
Absolutely, and thank you for clarifying this. One other point, and Louise, I think this is probably one for you. It's regarding the MedicSpot partnership with the NPA with regards to Apologies, I'm just trying to find that question here. There's so many questions, as you can imagine. This is what you covered already a little bit, but maybe just reinforce this as well in terms of what type of tests are available for our members through MedicSpot, and how does that fit in with the D8 self-declaration or the UKAS registration, please?
Okay, thank you, Jasmine. So the partnership we've got with MedicSpot is all in relation to the PCR test. MedicSpot are UKAS accredited, and they're going through their accreditation cycle at the moment. And they will take, as said before, they will provide an end-to-end service working with the laboratories, the accredited laboratories. Part of that service is the service that the pharmacists provide is actually the provision, so the OT sale of the pack with advice and information about the service, so the patient knows exactly what to do with their test kit, which they will sample at home, and then they will send back via courier to a lab, who will then provide their results to the patient, and also will notify the relevant authorities of that result. So it's an end-to-end service. What the pharmacists have to do is to self-declare, so they have to do the Department of Health and Social Care declaration, and that's what they have to do to be part of that service. What MedicSpot have done, because obviously there's a lot of information that is required, they've actually produced a template which gives details of their medical director, all the different elements that they need to have completed. And within this document, it will help the pharmacy teams, because there's 66 questions on the self-declaration, yes, and there is answers to all of these questions that MedicSpot have provided, and some of which can be uploaded onto the system. So it's a very easy system, but they're meeting all the requirements.
Perfect, and thank you for that. Question coming through now, and again, a couple of questions on this. I'll just try and summarize it into one, is the cost of the UKAS accreditation, and what happens if the person submitting for that is unsuccessful, actually.
Okay, so the cost for the application for accreditation is £1,500 plus VAT. You wouldn't be rejected at the point of application. Application is really to get a fundamental understanding of what you're doing as a business. We're not requesting quality manuals, procedures, evidence that you're meeting the requirements at the point of application. When you self-declare and you apply with UKAS, we review what you have submitted, but John, I am right in understanding that we still don't require all of the quality documentation at that point?
No, at the point of application, yeah, it's the initial things that we would routinely check for you as a business, but then later on we would expect the other documentation as part of your stage 2.
So yeah, if you're looking to apply in order to provide these services, I think the important thing is that if the regulation applies to you, accreditation is a must if you want to continue the sampling activity or the testing or start any of those activities as a business. We do appreciate that there are costs of accreditation, and we're operating in the public interest. UKAS are a not-for-profit organisation, so our only charges relate to the assessment time and the time of our experts and professionals to undertake thorough assessments from the point of application through to the point of gaining accreditation. We do appreciate that there are costs to this. And this particular regulation has been put in place for private providers. So to an extent, you will need to make the decision as to whether the service you are providing is financially viable to continue, given that there are now costs of accreditation associated with the regulation.
Okay, so that's helpful to know as well. Thank you for that. I would like to cover a few things at the moment, just from our perspective, because one of the things that John, that you mentioned in the slides is appropriate indemnity.
Yeah.
Now, obviously, for pharmacists, it's also a requirement of the GPHC that pharmacies have appropriate indemnity cover in place for the services that they provide from community pharmacies. So if I may just take a little bit of a detour here and come to my slides, which I can share. I just wanted to cover off where we are at the NPA in terms of indemnity for our members for COVID-19 testing. So can you see my screen now?
Yeah.
My slides, yeah. So the question that we are asked is, will my professional indemnity insurance cover the pharmacy for the sale or use of COVID-19 tests? So essentially, if any pharmacy, any NPA member pharmacy that is considering providing any form of COVID testing, privately in particular, or is already providing COVID testing, is strongly urged to check the NPA website for information on this, or contact the Advice and Support Services Department, which is the Pharmacy Services Department, to make sure that they are aware of the NPA position statement of what is covered and what are the terms under which you will be indemnified. So NPA insurance will cover the sale, supply and use of COVID-19 antibody, PCR and antigen testing kits, including the use of antigen and PCR testing kits for the purposes of requirements to travel in accordance with the contents of professional indemnity insurance policies. And I'm not going to read all of it, but from a private perspective, for private providers of COVID-19 testing, cover for the private sale, supply and use of COVID testing kits will only be provided if the bullet-pointed conditions here are met, which means in England, the requirements of the Health Protection Coronavirus Testing Requirements and Standards England Regulations 2020 are followed, including implementing the UKAS process for application, appraisal and accreditation as required for the activity that you're doing with regards to COVID-19 testing. The test must be CE marked. It must comply with the latest MHR requirements, advice and guidance. You must carry out a full and thorough risk assessment in accordance with the pharmacy regulator's advice and guidance. Limitations of the tests must be explained to the patient and customer, and they must be reminded of current government guidance with regards to tackling COVID-19, including where necessary, the need to self-isolate, maintaining social distance, and the use of PPE. And the pharmacy must comply with all government guidelines and legislation with regards to sharing of data, including the need for reporting positive, negative, or inconclusive test results. So that is really important. And it is a condition of providing indemnity cover that these conditions are adhered to. So anyone, any pharmacy, any NPA member who's currently providing, please familiarize yourself thoroughly with this. And if you have any questions, please do get in touch with us at pharmacyservices@npa.co.uk. So just want to also cover very briefly, what do we mean by the regulators' requirements regarding risk assessments and things? So on the 1st of February 2021, Public Health England issued an updated form of guidance on COVID-19, summary guidance for service providers on point of care or near person tests for diagnosis and management. Off the back of this, the General Pharmaceutical Council also reviewed and updated their own guidance, and they changed their previous stance with regards to pharmacies carrying out COVID-19 tests. So now the GPHC is no longer asking community pharmacies not to provide rapid point of care or near person antibody COVID-19 tests or for anything. Generally speaking, the long and the short of this is, if a pharmacy is providing any type of COVID-19 tests, antibody, antigen, lateral flow, PCR, any form of COVID testing whatsoever, then the GPAC expects the pharmacy to carry out a full risk assessment first before providing the service. And in that risk assessment, it's really important for the pharmacy to consider the end-to-end process and whether all the components and parties involved meet the requirements for the service to be safe and quality assured, how the results will be fed into the wider surveillance network and or part of a clinical study as relevant, and how the pharmacy will make sure that suitable training is delivered for all healthcare professionals and staff members involved in the service so that they're aware of the roles and responsibilities of everyone, including providing evidence-based information to people using the service in line with government guidelines. So this all links into a lot of what John also covered in the part of it, that as part of the UKAS accreditation process, all of this is looked into, suitable indemnity, training, and all of this is looked into as well. So it all dovetails in nicely, doesn't it, John, in a way? So, yep. So moving on, the PHE guidance that I'm referring to was issued on the 1st of February. It covers a number of key points, which includes general points on testing, the different types of tests available, and also gives information about some recent evaluations conducted by Public Health England on some of the different types of tests available. It also contains a summary of the relevant regulations and guidance, which of course refers to UKAS accreditation as well in that, and the health protection regulations. It talks about how to manage the test results, what do these test results mean in people with COVID symptoms and those without, etc. So the full guidance can be accessed on the gov.uk website, and is strongly recommended that this is read as well. In terms of the NPA information for members, we've issued quite a lot of information to members highlighting all the key points from the previous 3 slides I've covered, which is PHE guidance, the UKAS's updated guidance, the NPA indemnity stance on things. The main bit, which the main pieces of content which encompasses all of this, is our superintendent update issued on the 16th of February on COVID-19 tests and the actions required, which covers a lot of this, including a summary of the UKAS registration process, etc. We will be issuing, as I mentioned, further guidance to members as an update in the next week or so. We will cover a number of these things. So from an NPA perspective, we recommended 10 key actions ahead of this webinar already. And this underlines the points that John and Emily have covered as well. So number 1 is please read, understand, and share with your team the full information and guidance from PHE about providing point of care or near person tests for diagnosis and management. Please also read, understand, and share with your farm teams the MHRA's guide to COVID-19 tests and testing kits. Please read and understand thoroughly and implement the UKAS guidance and FAQs, which requires completing the relevant actions for self-declaration and the UKAS registration as required for the activities you're doing. Please read, understand, and share with your team and implement the GPH's updated position on supply of COVID-19 tests from pharmacies, and refer to it for more information. Please conduct a full, thorough, and a proper risk assessment before you start providing any COVID-19 tests or testing services. Please ensure you have suitable indemnity and insurance arrangements in place. And as I said, please do contact us if you've got further questions on that. If your pharmacy is already providing COVID-19 tests and you haven't reviewed your practice recently, I would strongly urge you to urgently review what type of service you're providing and what your UKAS accreditation requirements are, what your DH self-declaration requirements are, and please proceed to make sure you meet those requirements as soon as possible. If your pharmacy is providing over-the-counter sales of just supplying the test kit, as Louise has mentioned, as part of a wider end-to-end service, please remember you do still need to complete the self-declaration with Department of Health, and use this checklist. Remember, this checklist is not an exhaustive list, so there may be other actions you need to take. And of course, conduct staff training on the COVID tests as relevant to the type of testing that you are providing. I'll briefly mention MedicSport earlier, which Louise has already spoken about. So MedicSport are an NPA business partner. They provide an end-to-end service and help manage the bulk of the requirements, which we've been discussing this evening in the webinar. And it gives pharmacists the ability to supply COVID-19 PCR test kits whilst meeting governance requirements. There is further information available on the NPA website on that, and in the information we'll be issuing next week, we'll include more information on this and links to it. So please do get in touch with regards to that. I'm going to stop sharing for a minute now. And there's some further questions which have come in, just as I have been. I think some of them, thank you, Emily and John and Louise, you've been answering them as we go along. So that's really, really helpful. We'll try and see if we can include a summary of these questions and responses online as well on the NPA website and things. Before I close off this evening, John, Emily, Louise, is there anything further you wish to add from your individual perspectives at this point?
Do we have time for one more question?
Absolutely, go for it.
It's the one from Katie, and I've said that it was going to be answered live so long ago. And
apologies, sorry.
Not at all.
Yeah.
No, she's just if she's still there.
Yeah.
She said, "What about selling kits to the public to take the sample themselves at home, but for the purposes of test to release?"
Right.
Now, John, I wanted to run this one past you because I believe for test to release, it still works in the same way, in that as long as the lab is approved, any provider can be a broker.
So if you are sampling for test to release, you have to use an approved test to release laboratory that are actually analysing, and those tests, they have to be done by PCR for test to release, but the laboratory has to be an approved and in the accreditation process itself as well, so that there's only a certain number of laboratories that are doing test to release.
So in this instance, the pharmacy isn't sampling, they're not doing the sample collection, they're selling the kits.
They're selling
But I think the kits can still be sold as long as the lab is.
I think it's, as long as that, if that kit is being sold, and then the person who's self-sampling then sends to that particular laboratory, then I think that's okay.
So you can still sell tests for test to release purposes, providing the contracted laboratory, the test that you are selling on the behalf of, is on the test to release list.
Yes, and I think that's really important to clarify, that it's very important to check the gov.uk lists of the accredited test providers, because there are different lists for general testing and testing for travel purposes. And it's really important that the right type of test is supplied in contract with the right, with the laboratory, with the right level of accreditation. Is that right?
Yeah.
Sorry, without tangling up myself. So that's really helpful. Thank you for that. Was there any other questions I've missed actually on that? There's loads in there that perhaps needs to be reinforced or picked up again or not answered yet, I think.
Yeah.
I think we've answered all but one.
Right.
So we might as well just answer that very quickly. Sorry to keep anyone. Just to follow up, what is the success rate as a percentage of successful applications? So at the point of application, it is 100%. You will get through application because we're not requiring anything from you. If you have any issues with the application or need information, please email sales@ucas.com and the team will be able to help you with anything that you need. I'm more than happy to help if you need additional information as well. So there is 100% success rate at that point, but then you need to evidence that you're meeting requirements along the way. So as John explained, you have 28 days to submit evidence to show that you demonstrate that you're meeting the requirements for stage 2. And at the moment, we are still in the middle of stage 2 review, so it's very difficult to put a figure on. You also get multiple rounds of stage 2, providing you're submitting those back and forth to UKAS in a timely manner. So it's not a case of you submit it once and then you fail and you can't continue. It's very much two-way, and we try to work with you on that. So we don't have a failure rate right now, do we, John?
I don't think we do, no.
Okay. No, thank you. That's very helpful. So next thing at the moment is we've had Simon join us. Thank you, Simon, because very quickly we would like all of our members today who are attending this webinar to actually help us with this next stage, because we'd like your help for the next stage of this. Simon, do you want to go for it now?
Thank you. Yes, very quickly. Just a very quick poll if we can. Also 2 quick polls. So I'll just launch that very quickly now. So hopefully in your screens you can see there's a poll. There's 3 questions in the first one. So if you wouldn't mind just going through that and filling it in, it's a single answer for each of those questions. So I'll give you about 30 seconds just to do that quickly. And then we just got a follow-up one as well. Apologies,
Yeah.
I was meant to launch this one before we started tonight, but yeah,
No, that's
better late
great.
than never.
I think actually our members today will also be interested to see what the responses are from everyone and what everybody's experience is in this space, isn't it?
Indeed.
So,
So,
yes, they're
okay.
coming in thick and fast, the responses.
They are.
A few more to go still. So there's 3 questions, so please do scroll down as you fill in your answers to that. Quite interesting results already, aren't they?
Right, I think that's... Oh no,
Perfect.
a couple more. Give it a few more seconds, and then we'll
Yep.
we'll stop that, and we can share it, as you say, Jasmine, just so you can talk
Perfect. I
through
think
that.
that'd be quite interesting to see the responses in here, definitely. So Emily and John, while members are completing that, and Louise, can I say a really, really big thank you for a really detailed and informative session. I'm hoping it's answered a lot of members' questions today. Definitely helped me out as well, a lot. Right, Simon, have we finished the poll?
We have. I've entered it now,
Yeah.
so our audience can see those as well. So
Wow. So you can see that the pharmacy teams are being asked almost on a daily basis, nearly 50% of our members being asked about COVID tests, and 37% quite frequently. So the vast majority are being asked quite a lot, actually. And a small number of our members are providing COVID-19 tests under the national testing program. So that's interesting to know, because we have become aware, obviously, that more community pharmacies are being involved in national testing programs, and maybe that will increase as well going forward. And a huge interest from members, 90%, interested in thinking about providing COVID-19 tests privately. Certainly, that is actually not surprising, if I might say, in terms of the level of interest. So I think there was one more, wasn't there, Simon, that we need to put in, or is this the...
there is indeed, yeah. So I'll just launch that one now. So I promise
Yeah.
this one's even quicker, because there's only 2 questions there.
Yes.
So yeah, again, so fingers on the buzzers. Please do send in your answers.
Be repeating one of them, but it's good to know.
Oh,
anyway.
sorry, yeah, do apologise, yeah. So
yeah, I think
earlier.
what we wanted to know more, quite importantly, is
the second question, isn't it?
Yes, following today's presentation, how do you feel now about this? And it might be a mixed bag of responses, I might say. And yes, responses coming in, a few more to go. I think we can appreciate the potential complexity of the whole process, can't we? I think that's what it is, because I don't recall any other type of service provided through a pharmacy before which has required UKAS accreditation. And I think that's what it is. It's a new thing, isn't it, Louise? I think you've heard that a lot, haven't you?
Yes, it's a new thing, and to be honest, it took us a long time to get our head around. So I can understand really the pharmacists. There's an awful lot of information from John and Emily to take in tonight, which has been excellent. But there probably will be quite a few more questions that probably will have, come to people's mind when they're actually thinking about it. And I think we just have to you just have to work through the process in pharmacy to see what applies to you. So.
Yeah, so
I'm actually somewhat relieved that 24% are feeling confident. That's a very good result. And as I've said so many times, if the sales at ucas.com is the team that can really help you through this, explain exactly what you need to submit to us, what you need to do, your time frames, what you need to know. And then sometimes if you've got technical questions that we can't answer, we'll send them over to John and his team, and we'll get those answers for you. So we can help you through this process. If you have any intention of offering private COVID-19 tests, please just email us and start there.
Yeah, and thank you, Emily. I think that'd be really helpful. I think what we missed out, and Simon and I had a quick private chat about that, is we actually meant to ask this question at the beginning, before John's presentation,
and then again,
to see how everybody felt at the beginning, and then try and do a comparison. But I think it's still, I think, somewhat confident is the majority of things. But given the complexity of it, I've got to say, I'm not surprised that no one is very confident, I think, because there is a lot to take on board, isn't it, throughout this process. So what this tells us is that I think the key message from me this evening will be, if you are thinking of providing these tests, and part of which a majority of you are, please do follow the action points that we mentioned this evening. The main thing is reading up and familiarizing yourself with what the different requirements are, the different guidances, and all of this. We are here to try and help you as much as possible. As Emily has said, Emily and her team are absolutely fantastic at supporting people going through this process, and certainly has helped Louise and myself a lot over the last
Definitely. Yeah, personal thanks. Thank you. Yeah.
Definitely. And John has been absolutely brilliant at giving a lot of information, which, despite everything Louise and I have discussed with you, Emily, I still learned so many new things today as well from John's presentation as well. Just to say, the slides and the presentation, this webinar will be available online on the NPA website throughout after the event. So if anybody wants to go in and repeat and have a look at it, that will be available. And Simon will be emailing things out to our members as well. So can I say huge thank you to everyone, and Simon, as always, for providing brilliant support that you always do. John, Emily, huge thank you from us. Thanks, Louise, as well, for your time. Thank you everyone for attending and staying through to us. It's what's been a marathon webinar, and thank you everyone. So good night, everyone.
Thank you. Good night.
Thank you so much.
Thank you.
Good night.